All right, good. Okay.
You're recording. We're good to go.
Good. Okay.
Yep.
All systems.
All
Okay,
systems go.
I see we have Jennifer here and Shelley, Richard, Declan, Runa is here. So that's awesome. We're waiting on a couple more people, but we're going to get started. So we're really pleased to welcome you tonight to Instincts at Work's webinar, What Now? From Disruption to Sustained Innovation. And what we wanted to sort of invite you to is this conversation that we've been hearing from our leaders all over about, you know, with COVID happening, as you all know, it kind of opened up some floodgates, both in terms of chaos, but also in terms of maybe some new opportunities. And a lot of people have commented on, wow, we managed to get changes happening that, you know, in 2 weeks that were taking, you know, years and years. Stephanie, hi, nice to see you. Judy. So the topic for tonight is to think about, we want to share with you some of our work at Instincts at Work. Our vision is about leading leaders in system transformation. And so we do a lot of work. There's some folks on the call who are clients of ours who we've already worked with. There's some people who we haven't worked with before, but we wanted to kind of give you a bit of background into that. So our specialization is really in giving leaders the skills they need to lead in complexity. We believe very much that the skills that are required are not the traditional skills, as many people are now coming to be aware of during the pandemic, that it requires different kinds of skills to be able to lead effectively in complexity. And that's really what our expertise is in and what we've been doing a lot of around the province, working particularly with groups who are trying to come together, like Ontario Health team groups, you know, even local regional examples of multiple health service providers trying to come together to stitch together how do we provide seamless care. And this is really a function of that complexity. So we're going to dive into that a little bit, give you a bit of background into how we work, a little bit of some key, I would say, concepts that we work with in our leadership development. But the topic today and what we really want to discuss with you is about what are you seeing in terms of disruption, the opportunity for more innovation, and really just sort of, we wanted to keep the webinar limited in participants because we want to have the opportunity also to have some discussion and coaching with all of you around how that's done. So I'm joined, as I said, I'm Penny Pesha. I'm the principal of Instincts at Work, and I'm joined by Renee Freeman, who is one of our coaches and also background as a nurse consultant, and actually also works in an acute care setting part of the time. So she stays fresh with all of the healthcare challenges of that. And we also have Sharon Lewis, who's going to be presenting content with me today. Sharon has an expertise in leadership teams, emotional intelligence, as well as working with healthcare leaders and, as I said, IT and other groups. So we're really happy to work with you today and kind of have an exploration about what now and how we can sustain some innovation. So we always plan for, this is one of the tools that we use, and we encourage you to think about it, everything that we kind of open up under the hood so you can see what our process is. We always talk about an intention and outcomes when we design anything rather than just an agenda. And what's the reason for that? We want to design for how we want you to be feeling at the end of this webinar or a meeting or anything else you're doing, and then some concrete outcomes. So we want you to leave feeling some hopeful about sustaining some innovation and to be able to create some further system change, because that's what we've been hearing from all of you, that you really want that opportunity. And in addition to that, for outcomes, for you to understand more about what are the opportunities in chaos, to learn some more about the importance of vision and how important vision is for keeping your attention on the right things to make progress during disruption. To understand a little bit, we're going to be presenting one of our concepts around the cycle of innovation, and that might help you to think about how you might be able to keep that going. And then, as always, we're very much about taking stuff from the theoretical into teaching concept, then into the application. So for tonight, we also want you to leave with maybe a strategy or two to think about how can I lead in this? How can I develop more opportunities in this? Okay. So I wanted to share with you a little bit about what we call, this is our model that we've developed around leadership, around the performance evolution pyramid. this is a leadership model that I think, that we've seen work in terms of really being able to ground people in what are the key ways of leading that are different in complexity. And so many of these components won't be new to you. Many of these are things that you've probably seen various, people talk about. You understand as a leader, what's the role of vision? I'm going to go in and describe each of these a little bit. Approach culture has to do with, are we putting people in an approach state? Is there psychological safety for doing the work that we need to do? So as leaders, you're well versed in that. And then the idea of growth mindset, which is really how do we help people cross their edges, which is sometimes uncomfortable, to be able to create new change. So some of these elements aren't new. What is unique, I think, in terms of how we think about it, is that the order is very important. And we bring into it the neuroscience to kind of underpin all of these elements so that people really understand what's the brain science around why these pieces are so important, and how do I do that as a leader to kind of ensure that we are able to continue to manage in complexity and not get into that deer in the headlights state, which is what a lot of people have felt, into that overwhelm, into that feeling of like, what's next? Where's the direction? And so these are the key elements: vision, approach, culture, and growth mindset. So let's look at the first element in terms of vision. And so what we would start with, this is our Why Vision card, again, part of, hi, Jen Mackey, nice to have you here. And if you could join us,
hello.
Just will mute yourself as you come in, that'd be great. So the idea of vision is really this. So this is the concept we want to share with you. And we teach this concept about why vision. When there's a clear and present vision, most people go through a visioning exercise, right? Whenever you have to write a strategic plan, what's the vision, blah, 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 depending on who you're working with. And if it's frontline providers, they tend to think, oh, here we go again, airy-fairy vision. And we talk about things in the abstract, and are we ever going to get there? And there's frustration about that. But the truth is that when a vision is compelling, and when a vision is alive and focused, it serves to align people. And so as a result of aligning people, and you can see in our vision diagram here, you're going to have, without the vision, so imagine we covered up that green arrow, we would have people pointing in various directions. And most of those directions have to do with what's in my best interest. Is it in my best interest? Do I want to have a clinic, or do I want to have after hours on the weekends? Do I want to be able to do this? How does this work in terms of my schedule? Does this make me happy? Does this work well in terms of what we're doing as a team? And again, there's nothing wrong with that. It's like to think that people are self-centered with that. But the truth is that our survival mechanism of our brain is designed around those things, around making us comfortable, around making things work in our world. And in the absence of a compelling vision, people forget, they don't align to it because the vision itself is more abstract. The vision itself is something that feels more distant. So that's, where we kind of pin it into the idea of vision being very, what we call in our acronym is it's future oriented. It has to describe a future state, not what you do now, which most visions in our experience, we provide the best patient-centered quality care, blah, 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 right? A lot of them are very descriptive of what we do now or what we might aspire to a little bit, but it's not clear in terms of where we're orienting to, what we're trying to achieve together. So the vision needs to be future-oriented, alive, inspiring, inclusive, and memorable, and it's for others and us. Now, a really critical part of the vision, and the reason why it's the core and the basis and the foundation of what we talk about and we teach you, is that really essentially we're trying to drive a shift in our thinking from safety to purpose. So in this diagram, or what we want to share with you from this, is the concept that we are all always trying to manage this shift from safety to purpose. This is a natural tension that we hold as human beings. So in COVID, when we initially heard about it, and we heard about what was happening in China, we might be like, okay, that's kind of a distant thing, and that might be something that we need to worry about depending on how much you're involved with infection control or epidemiological data or whatever else that your specialty is. You might be slightly more concerned. So there might be a little bit more of that orientation to safety. But once you start hearing about people in your community, people who are being admitted to your hospital, somebody who you knew at the grocery store, we start to move more into that safety orientation, right? And that's a normal, again, drive that we have. But what tends to happen there is we function more from the amygdala. The amygdala in the brain is sort of more activated, scanning for threats. It's why we see during times like this elevation in terms of people's conspiracy theories, because people who don't have the ability to kind of question what's going on or have rationality about that or weigh the evidence, not to say there's not some conspiracies going on, but I'm just saying the preponderance of them is indicative of the fact that we're in this amygdala hijack state. People are very fearful. If you go out, you notice that people are very quick to anger or to say, let's keep a distance. Or so we see more of this reactive mindset activation going on. And people tend to move into this mode of comply, protect, or control. These tend to be kind of fixtures of behaviors that we see when people are particularly in that safety orientation, that reactive orientation. A frequent thing that we coach leaders on is they'll say, well, my people are constantly telling me, well, what should I do now? I want them to think at a higher level, but they're just being compliant. The first step we always go to is, how clear is the vision? Do they know where you're headed? How many times have they felt like they've stepped on somebody's toes, or somebody in management has reacted badly when they've tried something new? These are all things that will stimulate people to stay in that compliance mindset, because they'll remember through their amygdala hijack, through the emotion center of the brain, oh, last time I suggested that something bad happened. And so they retreat into this compliance, okay? The goal is to move people into this creative mindset, into relating, revealing, understanding, and achieving. So we want to orient people more to their prefrontal cortex, more to a sense of what's possible, what could happen in the future. And this is an important shift that we try to make. But and this is based on the research actually of Jay Van Bevel, who's done a lot of work on in-group, out-group. So he's looked at the fact that our default in our brain, if we don't know somebody, is that they're a foe, not a friend. And in fact, there's evidence that shows that we actually analyze, or we think about what somebody is saying to us. If we've decided they're a foe, we process that with different circuits than if we've decided that we're a friend, that we're dealing with a friend. When we're dealing with a friend, we process what they say to us with the same circuits that we analyze our own thinking, or that we process our own thoughts with. And so there's literally this idea of this wall or this boundary. And of course, this has a lot to do with why discrimination exists, why racism exists. It's a natural process to think about who's in my in-group and who keeps me safe. That doesn't make it right, it just makes it so. But it's something that we have to continually try to overcome and override. And one of the ways that's been shown to be most effective is in creating a compelling vision. Because when you have shared purpose, all of a sudden, those people who are, back to the arrows, chasing that shared purpose with you become part of your in-group. And so this has very, very strong implications for our work together as we try to break down barriers between organizations and sub-regions. So start to think about, how do we bring groups together? And in the absence of this vision, people are going to focus on their differences. They're going to say, well, we deal with these people, we deal with this mental health population, or we deal with people who are in, the South region, or we deal with people in the North region. That's not the same as the South region. If you can look at it as a leader, as this is evidence of this safety orientation, to try to think about, how do we control how we're thinking about this? How do we ensure that we're successful? So people are in that safety orientation, but we don't have a compelling enough vision to pull them out. And so that's a key element of this. So just wanted to give you a little bit of another model that we use a great deal, that we feel is particularly relevant as you're moving forward in this particular time. It's been relevant. We've been teaching it for a while in healthcare, but what we'll say to you about it that's quite interesting is that all of our leaders who we taught it to called us up and they're like, I need to see that Cynefin framework again, because I really, we're right in the middle of complexity and chaos. So they have now the embodiment, the felt sense going through the pandemic of what this really means. So the benefit in sharing it with you is you can now map it as something more than conceptual. It's something that's quite real for us. So the idea of Cynefin is that this is the work of David Snowden. And what he's done is sort of map out different contexts about how we make decisions, how we understand our world. So in a simple framework, which is, the bottom right, there's a lot of relationship between cause and effect. So in other words, we might say, okay, let's talk about a best practice. This is the world of best practice. Let's sense what's going on here. We can categorize. We want to make quick decisions. Does it fit into this box or this box? And then we can respond to it. So this might be something around hand washing. We know hand washing is a best practice. This seems to be a good thing that we've, taken forward. We know that if we wash hands and we wash hands frequently, we wash hands with soap, that's going to have an effect. It has to be at least 20 seconds. And, we wash hands in this particular way and X number of times a day, and that's going to reduce the spread. So that's within all this complexity, we have a simple framework that we can hang on to about something that's, understandable. We then get into complicated. So complicated is the realm now, and you can see from the diagram, there are many more variables here. So this is a good example of, I'm sure some of you can already sense where I'm going with this, wearing masks, right? Well, does it work in this situation? Does it work in that situation? As we saw, the medical officers of health were like, should the regular public be wearing it? Is it just for healthcare professionals? So all of a sudden, there's a little more complication in this. There's more variables. And so we can only have good practice here, not best practice. We don't know for sure all the conditions. And as they were working to sort of figure out what those conditions were, we started to try to look at different data points. So this is the realm of the expert. We're looking for data. Even now, as we're searching for understanding transmission, understanding all the rest of it, we're looking to understand what did the scientists, what do the experts in the field tell us? So they're sensing, these are the patterns, and then let's analyze it and let's respond, right? But then we have situations where moving into complexity, where there are so many variables that it's actually hard to sense any linearity. This is the realm where expertise breaks down. And really that's what we were thrust into with COVID. We had some experts who knew some things, but there were a lot of unknowns, many unknowns about the virus, the spread, the symptoms. It was constantly changing. How many of you were in a situation, okay, this is the protocol. This is what we know today. And that changes by 4 p.m. and you're changing it all over again. So this is the world of complexity. And we have different practices in this. So really back to that safety to purpose, one of the strategies we try to move to is what's known. And we've seen leaders burn out because they're really focusing in the complicated realm where what's known, if I stay up, I read all the journals, they're looking for the answers where none exist or where insufficient answers exist. And so we had a story of one of our physician colleagues who said that they actually had to actually ask their chief to step down because he became so reactive, because his normal way of acting, which was to try to get all the expertise information, it wasn't working for him. And he became so reactive in it, he was creating all of these threats with the rest of his colleagues. And so this became a bit of a breakdown in the structure, and he wasn't able to function well. And we've seen some of this with our colleagues where they really hold on to what can I know here? But in complexity, the goal here is really what are the best questions that I can ask? That's the probing. So we probe and sense and respond because the linearity, the cause and effect has broken down. No one person can see the answer. And the more we move into OHT environments or whatever other structures you're working through to create collaboration, the more true this is. So solutions become emergent. That's why the practice there that we talk about is emergent. They emerge rather than being predetermined. And this is partly because there's so much novelty because of the number of variables that we're working with. Then we tip right over into chaos, which is the next line. And as David Snowden likes to say, this isn't a line between simple and complicated and chaotic. It's actually a cliff. We see people go over that cliff because in chaos, we actually just have to act. And I'm sure many of you have had this experience. You don't actually know. You have to come up with a protocol. You've got to deal with these patients, or you've got to deal with the calls you have coming in. You have to work out an assessment center or whatever it is that you're working on. So you have to just do it without the assurance that you're doing the right thing. And sometimes we find out later if that was a good decision or not. But we can't know. And so this requires a different kind of mindset. It requires a mindset as we work with more people that instead of being focused on control and rightness and limiting the number of variables, which is what we often do, the brain desires to limit the number of variables, we actually learn how to cope with the complexity through how we ask questions and how we kind of deal moving forward. Okay, Miss Sharon, are you good to take us further on this journey? Go another layer deeper?
Sure, I will jump in. And we just wanted to draw your attention to these different domains and how some of what we're doing in the domains is similar, but it's very different in terms of the order. And once we get into complex and chaotic domains, we actually need to start introducing, introducing new skills. So in simple and complicated domains, our sensing of what's happening is us like feeling into the environment with our eyes, ears, nose, like the way we sense. So it feel into the environment so that we can detect a pattern. And when we notice that pattern, gradually our sensing gradually becomes automated because we do it often enough. So this is, the realm of, a surgeon who the first few times you're trying to cut something or someone, it takes a lot of concentration, effort, skill. Eventually your body sort of remembers what it's doing and you're sensing automatically. You're not having to put a lot of thought and effort into it. And that sensing becomes automated. And that can happen very quickly, and then our analysis kicks in or our categorization kicks in, and then we know what the right thing is to do. So that's in a situation that's very stable, in an environment we know, that can happen. It can happen well, it can happen fast, we can get efficient at it. This is why we build process and procedures and have protocols for how we do things in a stable environment. There's a lot of efficiency that's gained there. Once we get into complex, though, the number of variables, as Penny said, goes up. Also, our ability to control what those variables are is diminished. So some things may be completely outside of our control. Think about, like a global economic system or something that's like way outside of our control. It's a variable, but we don't have any agency over it. So in those situations where there's so many variables and so little control over them, we have to do a lot more probing. We have to slow the sensing down. It can't be automated. It has to be slowed down. We have to sort of probe into the environment and what am I seeing, and then respond based on that slower sensing. We can't trust the automated sensing in those situations because it tries to see just the patterns that it knows. And that's where we get biases like a confirmation bias, because we'll just delete data that doesn't match a pattern that we've already seen. So in order to be sensing like that and probing, we have to be present enough to sense the novelty. And in order to do that, we have to stay in that approach state. So we've got to be really good as leaders, really good at managing ourselves, really good at taking those pauses and taking care of our emotional state and managing the fear so that we can take the time to probe and sense and respond. And then in the chaotic, as Penny said, it's act first, but in chaos, we can just act and keep acting and keep acting and keep acting. We do have to act and then take a moment to check out, is what we're doing in the direction of the vision? So again, that requires a lot of self-management, because when things are like going completely off the rails and we don't understand even what's going on, to pause and do a little bit of evaluation to say, did that move us in the right direction, is a really challenging thing to do. So for leaders, again, you really have to work on those approach state self-management techniques. Good. So, but there is a trade-off there. As we slow down, we can start to see new details and new patterns. Those become more. We have an ability to sense them as we slow down and take the time to do that, and consequently, we can see more opportunities as well. All right, so we probably have all experienced that in the chaos, that there's an opportunity that arises, that people feel the need to act, and so opportunities show up. So what, I wonder, are the opportunities that you've seen so far in the chaos that has been COVID over the last few months? And if you want to, take yourself off mute and just popcorn style, a couple of opportunities that you've seen, or pop them into the chat.
Hi, Jennifer here. One of the things I've noticed is that we've had to stop doing some things that I think we needed to stop doing, but it gave us permission to because of the chaos.
Great. That'll come up shortly. I'm glad you mentioned that. Absolutely. Any other opportunities that people have seen?
Well, I think, prior to COVID, as we're trying to work through even some of the OHT stuff and other stuff, it was, kind of a slow going process in terms of trying to develop relationships. And I think what COVID has done is kind of give people a reason to work together and recognize the need to work together. And you kind of get into that kind of acting mode bit, and then you kind of, I guess, acted your way to trust a bit, that, as you kind of, like I said before, once you get to know people and you're working along with them, when you hadn't, you're more likely then to be receptive to continue on and look for other opportunities. Great.
Good. So 2 good examples there. Is there anything else quickly, or should we?
Richard said in the chat, increased communication and thus building connections. And Judy agreed with that. So we're seeing that as well.
Yeah. Great. Good. All right. So let's move on. There's one example that we picked up from, I think, news sources, which we think is a great example of this. In Kingston, they repurposed safety inspectors from the food industry into old age homes, retirement residences, and they discovered that the increased focus on safety of food handling and just general sort of cleanliness protocols made a big reduction. I think, I don't know if they still haven't had any, but at the time of the article, they hadn't had any infections or deaths in those facilities. And that's just it's one of those things that in the midst of chaos, somebody made a decision and took an action. And then, once you see the results of that, that is an innovation then that can be spread further into the system. So the Cynefin framework helps us integrate sort of an age-old paradox about, should we be designing our organizations for efficiency and replication and the ability to do something known really well, or should we be designing them for innovation? And what the Cynefin framework really illustrates for us is that we need to be doing both. And we need to be doing both very much depending on the context that we find ourselves in. So, in a situation of complexity or disruption, as we've experienced in the last little while, we need to be innovating and experimenting. But that kind of constant newness and keeping us in chaos and complexity all the time does exhaust us, right? So we need to, as we sense which of those responses are useful, then we need to start distributing those, right? So we change how we're organizing, and the OHTs are great for this because the OHTs are a central body, but not a central body that is controlling and deciding what the actions are going to be. The central body is more about gathering information from the periphery where the experiments are happening, distributing it throughout the rest of the area. And then once those distributions are starting to happen, then we can start to assess and replicate and gain efficiencies on things that are working. And for some of those innovations, they're just not as effective as we thought we were when we do the analysis, and we get to, chuck those. We need to start normalizing, and sometimes the context will change, and, we need to innovate a new solution, and those, then like Jennifer said, there's a bunch of outdated things we've been doing all the way along that we don't really need to be doing. We can jettison those, so we have to kind of normalize that retiring of old procedures that don't work the way they used to. And then as we replicate and get a little more efficient, then we find the things that really work that sort of float to the top. And for those things, we develop budgets and staff and support, and, we make that part of our ongoing operations, but again, always sensing as the context changes, then we move back into the innovation as well. And so this cycle really helps us think about, two ways. People have preferences for how much newness and innovation they actually want to experience. And rather than fighting about, do we tool up for innovation or do we get efficient, we need to start looking at how those things work together a little bit better. So,
can I just pop in there and say, in healthcare, we tend to have a lot of people who, by virtue of the work, are very, risk averse and driven to stabilize and make sure that we only use evidence-based kind of solutions for things, which at the point of care in a clinical practice makes very good sense. You don't want to be going into your doctor or nurse practitioner and saying, hey, I heard about this new thing today. You want to try it? I picked some up at the grocery store. Maybe this will help you with your rash. You don't want to be innovating at that point of care. But the problem that we see in leaders is that they have trouble switching hats. So that way of thinking serves really well in that context. But as leaders, we have to learn how to be open to these other ways of thinking. And encourage this diversity, what we like to think about as a diversity of thought, to enable more innovation into the system. And that's part of what we're seeing here.
Good. So just sort of drilling into that complexity domain a little bit, because as we stabilize the total chaos that was the initial stages of COVID, things subside back into the complex. And just as a side note, as soon as you add a human being with an emotional system, which gets tuned up for its own, based on its own history, as soon as you've got multiple people working together, who are feeling things, you're automatically in the domain of complexity, right? So when dealing with people, you have to do a fair bit of this probing, sensing, and responding. So as we move into complexity, we need to add some new skills as leaders. And the skills sort of map onto probing, sensing, and responding. The asking good questions is very much a probing skill. Good questions are usually open-ended. They usually come from curiosity. They're not sort of like, why did that go wrong? Whose fault is it? And good questions are often the ones we don't know the answer to. And those can be scary questions to ask. So, as a leader, we have to, again, get really good at managing our own emotional state and being willing to be vulnerable to ask those questions we don't yet have answers to. So that's asking good questions is essential for probing. In terms of sensing, listening, empathy, being able to feel what the response is from the questions that you're asking, from the information that you're gathering. So listening really well, empathy, those are sensing skills. And then responding, making sense from the data that you're gathering, from the experiences that you're having, making sense together, so collective sense making, and designing solutions and ways to respond together. You know, those are skills, again, that, you know, in an expert model, we don't develop the skills of collective sense making. We develop the skill of, you know, learning everything we can to be really brilliant, and then we know the answer. So these are new skills for leaders often.
I just wanted to comment, Sharon, because it made me think too about, you know, part of the struggle now and how things are shifting is that there's probably, one would sense, you know, and I've heard some of this from our leaders as well, there's a big focus on maintaining capacity now in the hospitals. And so that's going to create this big push, right, into primary care about how we deal with all the people who are no longer, you know, going to be in hospital. So there's going to be this move likely to more centralized control over some of these variables. And yet when we move into primary care, particularly, it being an area of great complexity because of all of the different players, because of all of the different organizations, we have a lot less centralized control. Right? So in a hospital structure, you still have, or an acute care setting, you still have centralized control. There's still a bit of a hierarchy and there's a structure there. But what's happening now is that as we move into trying to do the uptake in primary care, there is a lot less centralized control. And so it's going to be interesting to see how is Ontario Health going to manage with that? How are we going to be able to deliver results? Because when we want to give assurances and have clarity, that moves into the realm of cause and effect. So we can say we want to end hallway medicine and we're going to do such and such a thing, but we all know very well when you're working on the ground, the layers of that. And that's what really COVID has exposed. It's exposed the layers of complexity that are real that you're dealing with. And so these skills that Sharon's just taken us through are really much more of a community development kind of perspective of what you're trying to develop from the ground up. And we believe firmly that's the only way that we're going to make progress in this. So we can stand from on high and mandate this and that all you want. But the truth is that's, we can wish for that, but it's sort of like planting an ear of corn and then standing over it and yelling and saying it's got to go faster. I mean, this is a process of development that needs to happen and can be helped by good leadership in these skills, but forcing it is not what's going to make it happen.
And as we start to release the central control as well, it starts to become more and more important that really basic, you know, pyramid, the performance evolution pyramid we started with, you know, as we start making those decisions and running those experiments out at the periphery of an organization, we have to have a really solid vision and a lot of safety and trust between, you know, the players at the edges, at the front lines, in the periphery, and those central places where the information is going to get disseminated. We have to have that in place because that's what's going to direct the innovation at the edges, and we won't be able to be watching everybody all the time to make sure they're doing the right thing. So yeah, so that's just to sort of connect it back to that performance evolution pyramid at the beginning. So the skill we had, we don't have time to go obviously into all of those skills and, you know, how to become experts in each of these things, but the one we thought we would look at tonight is the skill of listening. And listening, you know, we think about it, lots of people have done work around active listening and being very present, you know, asking good questions, reflecting things back, you know, that's the technical of it. But what are you listening for? And in complexity, what we're listening for is, you know, we're listening for patterns, something that's happening again and again, something that's trying to emerge. And when we can sense that, then we can, you know, we can build to support whatever's trying to happen. then we also need to be listening to the whole system. So we can't just be listening to our favorite colleagues, to the experts that we've known and we're familiar with, the ones we've trusted all the way along. We have to start listening to the disruptors. We have to start listening to the people that perhaps aren't being served. So when we start listening to the whole system as leaders, things do get more complex. But then again, we're listening for those patterns, and often the people that are the disruptors are the ones that are holding the key to what's coming next and help us get on top of it a little bit. And then we also need to be listening for growth and progress and effort. And this is very important inside the organization. The more we're trying to experiment and innovate, the more uncertainty there is, the less we get that sort of the dopamine hit of goal accomplishment, where if you have a really good procedure, you can say, okay, I've got this to do today, and you go through the steps, and at the end you get a result. That's very sort of satisfying, fulfilling, helps us feel like we're, making progress. In the more complex environment, we need to be listening for the effort, listening for what edges people are crossing, what difficult things they're taking on, and commenting on that and celebrating that effort and progress as well. Otherwise, people don't get those neurochemicals that keep them engaged and satisfied and fulfilled in what they're doing. Good. Wendy, anything else there?
No, I think maybe it's, it's a bit of a fire hose of some key concepts there, but just to sort of take a little digestion break, we wanted to leave some time to kind of talk this through with you and maybe have a bit of conversation. So ultimately, we kind of want to have a conversation about what you might do to continue to foster sustained innovation. So, let's open it up and have a bit of conversation about some of the elements we talked about the important role of vision to bring people together across divides or separations. And I think Declan spoke to this when he said, with COVID, like people have started, as Churchill says, never let a good crisis go to waste. Like, why do crises work like that? Because there's a clear and immediate danger, back to the safety orientation, but it actually functions to push people into a sense of communal purpose. So if you look at the pyramid, they actually have a vision that's not distant, it's actually clear and present, which is great, right? It goes from something abstract that we don't have to worry about to let's do something now. And then with that approach state, there's a fair bit of, you'll see groups come together and coalesce around that. And so there might be some people who push back and they retreat, back to we've heard that from many of our leaders, that they've been shocked at some of their colleagues when we talk about that control, comply, protect, that they protect. They basically are like, I'm not doing this, goodbye, turn out the lights, shut their office door. So we see that range of behaviors, but within that, we'll see some people coalesce around, let's really do something here. And then we're able to break down these barriers. So I think thinking about what we're trying to do is expose the architecture of that and say, how do you continue that in a purposeful way going forward, right? Which is really about, you may not have the same degree of burning platform, but you can create at least a warm platform, and you can create some alignment, and you also can create that idea of psychological safety. And now you have a very concrete example of what is possible that you can hold up to say, look at what we did, how do we move from here? So it's those various elements and how you listen and design into that can be kind of helpful skills to continue to practice. So that was sort of my little tying it together summary. So let's open it up and just have some conversation. What strikes you? What are you thinking about in terms of what we've talked about? Is there something you want to experiment with, or something you're working through in your specific environment that you want to maybe get a little bit of coaching or support on? Please share with us, and then we can we can go a level deeper.
Jennifer here. One of the things that I was looking at early when COVID started was from the business sector. University of Guelph had some free seminars, and there were some business folks talking about scenario planning as a way to figure out what might we do, how might we repurpose, how might we think differently. And that was in the days when we didn't think it was going to be so long. I think that business thinking to identify scenarios and possible impacts, like brainstorming the impacts and then analyze what those might be without coming to conclusions too quickly, is a way to sort of engage those that might not think they have something to contribute, but they actually do because they're frontline staff, for example. And I think it's sort of weaving a bunch of those different opportunities of talking out loud, thinking out loud from different sectors of the work that assist the leaders to identify some patterns and to move forward.
Mm-hmm. That's a great idea, great suggestion. I think, again, back to that diversity of thought, we've worked with leadership teams, let's say inside of a family health team, where the physicians inside of their FO still had a very kind of structured way of working with their admin staff. So the admin staff, back to the compliance, were very much like, okay, well, we don't make decisions. You tell us what to do, doctor, and you tell us how this is run and whatever. But the physicians felt very disengaged really from the day to day. They were doing their work, but they didn't really know what was going on at the front desk. And so through this process of back to the vision and saying, okay, what else? And it's similar to what you said, Jennifer, with the scenario planning, like, how can we do this differently? And they were liberated to think that way. You know, an age-old problem that they'd been working with for years around how they were going to manage the phone systems and the volume of calls on a Monday, this admin group kind of sat down and they were like, okay, this is how we're going to do it, because they believed in it. They trusted that they actually wanted a solution. People were able, if you can imagine, no, it's not that nobody wanted to do this. They wanted to do this, but they didn't know how to step out of their kind of unconscious roles, right? About who's, back to the complicated frame, who's the expert. Well, you might be the expert on, you know, primary care or your particular patients, but you're not necessarily an expert on how the front desk runs or how what the patient flow is. So it was changing that frame a little bit to bring in that diversity of thought, and they generated a lot of really great solutions and actually, like I said, solved the problem themselves around how they were going to quarterback the calls and dealt with it very, very successfully, very quickly. So there's a lot of these opportunities that if we can get out of our assumptions about who has to solve the problem or where the solutions come from, and I think that scenario planning could lead to that exploration in a kind of an easier way where we're not so locked into our usual route of problem solving.
I don't think there's an easy answer to this one, but you know, I think the challenge moving forward is what you talked about, and that is the retreat. We've seen so many fantastic things as a result of COVID-19 in terms of the technology. You know, Declan and Richard will know of VTAC that we have here locally, the virtual triage and assessment work that's being done by a whole assortment of partners at the table. What makes me nervous is going back to the way it was, and there will be such a push to go back. How do you stem that tide, I guess? And I think I know the answer, and that is you're going to have to put a lot of effort into a lot of conversation.
Mm-hmm. Mm-hmm. So Paul, talk to me a little bit about that. How do you see that? How do you see people going back? What might happen? What are you anticipating there about people going back and why they want to go back?
Well, I think a lot of people will go back because their comfort lies in the older processes and the way they used to do it. And I'm not going to dismiss for a moment the fact that people want to go back to their doctor's offices, and doctors want them back. Volumes have been down in emergency rooms, and there's a financial equation to that, or component to that as well.
Mm-hmm. So that's back to kind of the barriers. There's sort of some barriers. There's some key issues there around dropping numbers in emerged departments that have a financial ripple effect. So that becomes an obstacle actually to new way of doing things.
Yeah, absolutely. You know, but there's a broader vision here, I think, and you know, I'm not sure if Declan will agree with me on this, but this virtual way of doing business probably has implications for what an Ontario Health team looks like locally for us.
Mm-hmm. So Paul, say more about that. So what is the vision? If you were to think about what would success look like in the next 2 years vis-a-vis virtual care and how it's provided with Ontario Health teams, if we could get out of the problem or where we see the barriers, tell me what you see.
Well, I guess what I see is, you know, the fact, one, you have electronic health records based system. That way people don't get lost in the system. Secondly, you have a cadre of physicians willing to almost work as a virtual family health team to take those folks on and deal with them. And what that amounts to for us is we don't have a whole bunch of folks that don't have doctors in a rural community.
Yes. So back to being patient-centered and seamless care in a rural community where access is a real problem, and presumably unattached patients are also a real problem. This can really address some of that. And so how might you use that vision to help engage your colleagues in seeing the light of what's possible here?
Well, you know, I think I have to go back to some of the things, and you know, I tried to take some notes as we went along here in terms of some of the effective skills that we need to apply, and I go back to what you were saying about effective listening and trying to find a trend in those conversations, and then build on those messages that you're hearing in some of those conversations. Excellent. To try to help move the yardsticks forward based on what others are saying.
Yeah. So I think your point of a lot of conversations is right, but the conversations you want to be having are sharing what the vision is that you see, sensing what people are feeling about that vision, and then probing to find out, you know, where are the places where they're excited about it, where are the places that they're concerned about it, and all of that sort of probing and sensing is really necessary to find the players that are going to do the innovation, right? That are going to sustain that are going to keep talking about that vision. And it's not the work we usually think of as leadership, which is sort of pull the team together and, you know, make sure that project plan is in place and, you know, drive results and that sort of thing. It's a lot more of building that coalition based on willing, excited participants, you know, who are engaged with the vision.
Yeah, the challenge moving forward for us at a local level, I think, will be building that coalition of like-minded folks and doing it in a timely enough way that the province doesn't have an opportunity to retreat on it.
Right.
Yeah. So maybe you already have an idea of who those folks are, but I think building that community to try to get some movement, because the truth is, and this is back to kind of the adoption of innovation, right? Like Simon Sinek jokes that there's always going to be that group of people, that 10 to 20% that, you know, the only reason they don't have rotary dial phones is you can't buy them anymore, right? So there's going to be that group, and you know who that group is in your community, and you can waste a lot of time trying to tip them or deal with their concerns. It's a lot better to focus your attention on the people who are already, back to the arrows, you have some alignment and you commit to moving it forward, because as progress is made and as gains are made, the other group will start back to the safety to purpose. They'll feel more safe. But you can't convince them from here that it's going to be safe, because you're asking them to go move into a future they can't see. And many of them are oriented already to just the losses. to the loss in income, to the loss in autonomy, to the loss in whatever it is that they're seeing in that picture. That's their orientation. And so that, you know, we often go at it from a rational lens to say, yes, but look at this and look at this, back to the limbic system. This isn't a rational discussion. If they're oriented to that and they're in that fear-based response, they will find reasons and rationales to support their felt sense of fear. And you're wasting a lot of your breath there. So I'm not saying don't talk to them at all. Listening is important because you want to know where the challenges might be, but direct your efforts into that coalition, as you said. I think that's a really, really good strategy and a really excellent point.
Yeah, and if you want to flip back to that slide, the Cynefin framework with the networks on it, Pen, just for a sec.
Sure, the first.
Because you mentioned, Paul, you know, doing, yeah, this one, doing, getting things going before the province kind of backslides, right? And what we're used to is that good practice structure of organizations where there's a decision maker at the top or in the middle or something. But in complexity, we want to start thinking about the province as sort of just another node. You know, they're the ones with all the resources, sure, but we need to start weighing ourselves as equal partners in that node and saying, no, province, you don't get it. You know, like this actually needs to work this way. And you know, it's the channels of communication probably aren't set up like that, but you know, you figure out ways to get those messages back to the province, and you stop relating to them so much as providers and deciders, and more as partners. So, you know, which is a mental shift, but it can be a powerful one.
You know, and the truth is people are looking there for answers, but we know from what's going on centrally, it's back to complicated. If we're operating from a complicated frame, how many people have said, well, we'll wait till the ministry tells us what direction we want to go. Do you think the ministry knows? Like, it's like the Wizard of Oz. Like, I've been using this analogy a lot, right? You're all going along the yellow brick road and you're going to get your brains and your heart and your whatever. And then you go back there and you're like, great Oz, tell us what to do. And there's a guy, you know, who's like, I don't know, you already had those skills. I mean, that's the message. And that's what's enduring about this, because whatever happens in the next election cycle or whoever gets in or whatever the financial situation is, you're still going to be there. You're going to be there with your patients, with your health service organizations, with your collaborations. You're going to be there. And so, you know, so maybe the news is good, that news is good, and maybe that news is bad, but the truth is, back to, you know, I'm full of lots of quotes today, but Margaret Mead, you know, never doubt that a small group of committed citizens will change the world. Indeed, it's the only thing that ever has. There's a reason for that, because the political will follow where you're getting results, right? And so your commitment is to those results, to what you know is going to work. And so we really want to encourage you as you know, as a group of leaders, to bet on yourselves, you know, to pull that through. And it ain't easy. We're not saying it is, but it's what's the other solution? 25 more years talking about, you know, now's the window's opened here. So
I think the other good thing about some of the changes that happened, especially in Renfrew County during COVID, isn't just that, you know, this virtual triage, the VTAC thing up and going. I think it was very positive in many ways, but also not only did you get people working together, but also there was a degree of integration that occurred with it that, you know, maybe we talked about for a long time trying to get going, but it actually kind of got it up and kind of going. Which was, and I think for the doubters, in many ways, it kind of then shows kind of what that actually looks like and how it actually is. It's a very concrete kind of example. It's not perfect, but a very concrete example of how a more integrated approach actually would have a positive impact. And the last thing I'll say is that, you know, when you talk to many patients or hear from many patients who are, especially if they've been unattached and having to resort to lining up in Emerge for their prescription refills and other things, they love it. I mean, and this is, and I think when I think a bit about this, sense making bit, part of the question is like, how do you involve like that whole public end of thing, and how do you kind of tap into that and get that kind of input from the patient end as well. And it's not just a group of us clinicians or administrators kind of trying to decide what's best.
Yeah, and the communication is great, Declan, because the communication networks are mapping, very much, like the organizational mapping in this diagram. You have to, the communication channels have to, move in all kinds of unfamiliar ways. Like you've got to listen to the frontline staffer who had 5 conversations with these people today that said the same thing, and that there has to be a channel from that peripheral node into somewhere where there's a decision to be made. So it's different, and the listening's important.
And that, I love the perspective you brought up there. We were in one community, and we happened to stop just on our way at this like little shop, and got into, somebody from that community said to us, "Oh, what are you doing here?" And we told them a little bit, and this fellow is like, worked in this candy shop, and he's like, "Well, I sit on the local municipal whatever board. He's part of the local city, structure, whatever." And he had so much to say. And I think sometimes we go to patients, right? And we handpick patients who are like the most, I don't know, they're the most capable of participating and verbalizing and doing all that. And so we have these handpicked patients on these patient advisory committees. But I love what you pointed to there, Declan. Who else in the community is aligned or can help inform how we need to shape this system? Because if we really start looking broadly at the determinants of health, we need other partners in there. And there's a lot of people that can help bring that to bear, I think, in a way that's quite innovative, that may not be as narrowly defined as a health focus, but might address some of these broader determinant issues that could have quite an impact, I think. And I think we have to cast that net wider to tackle these, because these are not, as you all know, these don't stop at the boundaries of just health and mental health, right? So that's a big factor. I guess I had some great ideas. Anybody else want to weigh in? We have Richard or Stephanie. Anything you want to add to the conversation, or? No, it's okay, you can pass. Richard?
Oh, I was just going to bring up, to Paul's point, I think the challenge becomes, it's just adjusting to the new pace of the normal will go now, because certainly the innovation, as you were mentioning, during the crisis of COVID, things just changed so rapidly. Would we have designed a system that went virtual care to 90% virtual care over a span of a week or two? No, because that wouldn't have been deemed to be safe in a non-COVID environment, but we did it because we had to act in that sort of way. So I think that the change for us in leadership now is just adjusting to, the innovation will take likely more in a collaborative sense, as Declan's talking about, with more meetings to plan and think through things carefully, but it's just adjusting to that pace, I think, again. And I loved your point, Penny, about making the strong why, the visioning piece again. And certainly for us in our area, the Renfrew County unattached patient list is our extremely strong why.
Yeah, amazing, good. Another piece, we didn't have all the time, obviously, to give you all the 6-month program all in one hour dose. It'd be great when we figure out mind meld. Maybe that's the next innovation. We do mind meld and it'll all go in. But a lot of what we work with is the idea of habits, right? So what we want you to think about is that the brain will back to the basal ganglion, how habits are wired in. To Paul's point, people will defer back to their habits. Why? Because it's the least use of resources in terms of the prefrontal cortex. It's what we do. We always do it. We show up. Well, how you drive to work, right? How did I get there? It's the automatic. And so if you can think about going forward, what are 1 or 2 habits that you're trying to instill that are different? And how do you structure that so that instead of glumping it all in all of the concepts and the thinking and the higher order thinking, can we reduce it in a sense to what's the one habit we want to continue? Maybe the one habit is around virtual care. So how do you make that easy for people to do? How do you reinforce that as a behavioral habit, as an approach? You know, so it's really in some ways starting to simplify some of those pieces so that you're able to think about it very strategically about some of those key behaviors. But the literature on habit formation is really, really relevant to this work. And it's part of what, you know, we've designed our program around, is helping leaders focus on particular habits, like how to move from reactive to creative, how to deal with how to be in the habit of talking about vision. What are the habits that are needed to create that approach culture? So we've designed the program around core fundamental habits that take time. They take time to reinforce and to develop and to embed, right? So what you've got is a scenario, as Richard just spelled out, where the bar for entry kind of dropped and we were able to see all this novel behavior. But what you're talking about is how do we wire in these particular habits? So getting clear about what some of those are could be really helpful.
I also think that you have to find a balance, because we've rotated hugely one direction.
Mhm.
Obviously, the answer is not to rotate back to our old habits, but there also has to be some balance in there. And I think that we have to be careful to make sure that we're looking at the balance that works for the particular organizations or peoples that we're involved with.
Mm-hmm.
Yeah, and the trade-offs, you know, the more complex and crazier and more chaotic the system, the more you have to realize that optimizing for anything is going to result in a trade-off in something else, you know, and sometimes we can't optimize for efficiency. We have to, you know, we certainly can't optimize for innovation. If we innovated at this pace, you know, forever, you know, we'd all be burning out and quitting. So, you know, it's that trade-off between keeping some innovation moving and, you know, making those things efficient and distributing them. And, you know, we talk about spread and sustainability. So it's definitely a balance. And that's what we're pointing to, right? We don't want to, instead of an elastic band where we've stretched it and you let it go. And like Paul says, we all then just go right back to the old replication habits. We want to keep enough innovation going that that things keep moving.
Good.
Good. Thank you all for being here today.
Yeah. And we wanted, so what we're going to do, I'm just put this up, but you're welcome to visit our website for some other resources. We'll be posting this recording and you'll be getting an email just to let you know that it's available. So, you know, feel free to come back, share it. Maybe it'll help to start a conversation with some of your other folks and talk about some of the concepts together and spark some conversation and some design on your end about how to keep the innovation going. And we wish you a lot of luck and are here to support you as leaders to do that, because, you know, that's really what's going to make the difference, or people like you carrying that forward.
Thanks so much. That was great. Thank you.
Thank you so
Thank
much.
you. That was fantastic.
Good.
Good.
Thank you so much for being here.
Thanks for joining us.
Thank you.
Okay.
Right.
Have a good night, everybody.
Yeah, and you. Bye-bye.
Bye-bye.